I'm not going to disclose in this point. This is not a safe
That's
environment.
my friend. He passed away, unfortunately, during that time, especially in the family.
And to have people sort of celebrate you for being able to endure and be resilient and not just living, thriving.
Living with HIV, taking medications just like any other chronic
That's the
illness.
reality of my journey with HIV. It started violent.
There's more to us than just these 3 letters.
Hi, I'm Clint. My pronouns are he, him, and I'm living with HIV.
Hi, I'm Nathan. My pronouns are he, him, and I'm living with HIV, and we are exes.
We are.
How often do you find yourself dealing with stigma, especially related to HIV?
I wish it was less than it is.
Yeah.
I'd say probably at least once every 2 or 3 days.
Yeah.
And it is mostly on the apps from the queer community, unfortunately, because realistically, the stigma doesn't come from the heteronormative community or the straight community, because you don't have to engage with them on that level. But constantly, the battle that I have and the most stigma I get is from people who should know better, who could know better, who are on PrEP, who are using medication on the daily basis to protect themselves from HIV, and yet feel the need to abuse, to shame, to vilify me because I have HIV. There's a big gap.
I think for me, I'm very similar. When I do disclose, it could go either one or two ways, but even with a person that I have no affiliation with, the simple question of like, are you clean or are you dirty is such a constant narrative, especially in our community. Mm-hmm. And it actually doesn't answer anything. It's not an appropriate question. If you want to ask me, hey, are you polls undetectable? I'll happily tell you that. If you ask me if I'm clean or dirty, I'll tell you I've showered. Because the question in itself, the use of language, is stigmatizing in itself. And I find that, unfortunately, like you, most of the stigma that I receive is from inside the queer community who don't understand, who have so much fear and internalized fear that they project it onto us.
And has it changed for you as well? Because I know it has for me. Like, I used to be, oh, look, that language isn't great, and be quite soft about it. I'd be like, hey, that language is actually a little bit offensive, but you should say, are you positive or negative, or have you been recently tested, or anything like that. But clean or dirty actually brings bad connotations. I used to be patient enough to do that. As it's gone on, and there has been a huge push in it's like when people used to, on the apps, used to go, no rice, no curries, no, all those horrible things, and they list their negatives. They don't, they've been told not to do that anymore, and we've been conditioned, and a lot of that has happened around the clean or dirty, but I don't have the patience in the same way that I used to, and I worry that was me becoming jaded because of the fact that there is so much education out there now, and there are so many people on PrEP, and there are so many people that are going to a doctor to protect themselves from a disease that they can't catch when they're on it, and yet they're still shooting insults at me and you and other positive people.
Ignorance in the face of such education and such availability to the awareness that their medication, irrespective to what we do, their medication is almost 100% guaranteed that they are protected.
Yeah, it's really hard sometimes.
You ready?
Mm-hmm.
Sure.
I'm so ready. Give it to me.
In your view, where does stigma and discrimination surrounding HIV originate?
Oh, fear and ignorance always are the thing where stigma comes from. And also we did a wonderful job of brainwashing people to think. And it wasn't it wasn't that HIV and AIDS wasn't killing people, because it definitely was, but like what they did was they weaponized it from the Grim Reaper in the bowling alley, which meant that gays and drug addicts, both pulled into one essentially, were coming for innocent families and children with their AIDS, and we were attacking them. And that ad that ran for such a short time in the 80s still reflects on the way that my parents responded when I told them, and still reflects on the way that there is a huge...
Yeah. And it's generational, and it's ingrained in social messaging. It's ingrained in old narratives that still exist.
Yeah.
The disease is very different today in the 21st century. It's very different.
Do you remember the first time you faced stigma or discrimination because of your HIV status?
Look, the point that I got diagnosed, I was in a pretty dark place, and it resulted in quite a lot of instances where I was attacked and I was beaten by people that were a part of my world. So when I came out as HIV positive, it was literally beaten out of me. Shit. To have your entire world shatter, and to have everyone that cares about you, their world shattered because of something that you couldn't control. And the discrimination that I got was for people that were really, really close to me, because they didn't understand, because they didn't know what was going on, because they saw Philadelphia, they saw the Grim Reaper, they saw a disease. And so did I. And I remember saying to someone, hit me. If you want to beat me, then beat me. And I remember them literally picking up their fist and going, because that's where I was. That's the reality of where it started. That's the reality of my journey with HIV. It started violently.
I mean, we do a lot of public speaking about HIV, which is the first time I ever did a live talk was the AIDS memorial, and it was the first time I stood up in public and said, you know, to a wider audience in particular, and said about my status and told my story, and it was really incredible to be celebrated for something that you had carried so much fear and shame, and so to finish a speech on that and to have people walk up and go, oh my God, you were amazing, or oh my God, that story is so inspiring. I have felt this, and I would have done this, or I haven't been able to conquer that myself. And to have people sort of celebrate you for being able to endure and be resilient, and to be living, and not just living, thriving with something that people consider a handicap or a disease or a break on so many lives. It was really odd. It was a really odd experience. It was empowering. It was great. It was the moment when I knew that this is going to be a part of my journey moving forward, because I want other people to feel strength from something that they cannot change. We can't change it, so let's embrace it and let's move forward and make people feel better about themselves as well.
The conversation helps share the experience. I think for me, when I'm most empowered is when I run a workshop, or I run a community event, and I'm talking to newly diagnosed people who are scared, who don't understand. And I've been there, I understand that. And we spend a couple of days together, and we talk about the experience of getting HIV. And you watch them kind of go through this beautiful blossoming towards the end. And I just love when I'm able to give fully what somebody else gave to me and give someone hope in a situation. I feel most empowered when I give and I share and I connect. That's when I'm empowered.